Welcome to Driven to Lead. I'm your host, Wayne Brandon. In this series, we explore the real world stories of key executives to find the leadership lessons that help move us all forward. If you like these conversations, we'd really appreciate it if you hit the subscribe and like button. It'll help us out a lot. But now we got another great program for you today, so let's make it happen. Very happy today to have with us Bryant Grigsby, the CEO and board member of PDV MedTech out of Northern California, Silicon Valley area. Bryant's an amazing engineer and business leader. He's got relentless curiosity and passion about so many different things. I'm really impressed. I think you might like to know that Bryant has a passion for outdoor adventure and exploration that led him to the U.S. Olympic canoe and kayak teams. He also co-founded a outdoor adventure park called Adrenaline Sports Resort. And his love for the outdoors also took him to the University of California at one point in the Lick Observatory, where he served as the staff astronomer. He's got an incredible enthusiasm for astronomy, and it materialized into 5 awards and 25 publications that Brian has authored and co-authored. So he's an engineering leader. He's a business leader. He touches so many different areas, and I want to dig in today into the medtech arena and some of the innovative things that are coming our way. Great to have today Bryant Grigsby. Bryant, welcome to the program.
Thanks for having me.
Yeah, it's great to have you here. Tell us a little bit about PDV MedTech. I saw in the description of the company that you first came into the company, I think in 2021. It was called something else. It was called Phoenix DeVentures. And then as a result of the work that you had done, some of the engineering expansion, moving it into multiple states, and some of the work you'd done in cancer research and other things, you attracted an investor, and now the company's merged and you're leading it.
Yeah. So if we rewind back, the founder of it is Jeff Christian, and he was an entrepreneur and really part of the heart of this company called ACS in the engineering world. And that was back in the early 80s, mid 80s. And if you look at medtech in Silicon Valley in general, there's a lot of branches from that company. And they really developed, close working relationships. And he was part of a couple of different startups. His last one, he was at got acquired by Johnson and Johnson, and he stuck out his earn out there and wanted to get back to his roots of doing startups. Except for this time, instead of doing startups on his own or with other folks, he wanted to support them. So he did the Silicon Valley thing and opened up a garage shop. Literally bought a house with a big enough garage where you could put a mill, a lathe, and a molding press in his garage. And he hung out a shingle, and the folks up at Sandhill, all the VCs up there, immediately started sending him work. And he became really busy, got his two sons involved. They became really busy, started expanding it. Needed a bigger garage because he wanted to stick with that garage mentality. So he did look around at renting a space and said, "Forget it, I'm going to buy a bigger house with a bigger garage." So he did. Fast forward a few more years, he's now got multiple employees working out of his house, not just his kids. Now it's time to finally grow up and get a real space. And so he went through a couple of different iterations on space. We ended up in Morgan Hill, and fast forward to right before COVID, he's starting to think about retiring and grew it successfully enough through word of mouth that we had a pretty steady business going and was starting to get the attraction of other contract manufacturers who are looking to buy a design arm or development arm. And COVID happened, so that got put on pause. Also, unfortunately, during that time, one of his longstanding business partners died of a heart attack actually in the office. Um, so he needed to figure out, who to replace him. Not that he could replace him. His name was Gary Hume. So who can come in and be his right hand guy and help him take it through to the next step where he can sell it, retire. His kids didn't want to take it over, which is a very common situation where kids do want to take it over, but they didn't. So I worked at a startup that, like startups do, they were running low on cash. And so I was presented with the opportunity to go find other things. And the timing worked out quite well. So I came in here. as Chief Product Officer. And it was a little confusing for me when I got here because I'd never heard of Phoenix DeVentures. I thought I knew all the contract engineering firms in the Bay Area. I've been doing this and working in this space long enough where I thought I knew everybody in the med tech space and didn't know about this little skunk works here. And we called ourselves PDV right off the bat. Like we've always called ourselves PDV because just people shorten things, right? And I did things definitely differently than Jeff, a little bit more standard standard practice on a lot of business things versus Jeff was very much a lifestyle business. But um, we both had the same mentality of we want to put our people and our lifestyle in a positive way where everyone wants to stick around, where this is a place they want to come, and not just because they're making money or they're it's just a job. It's always been about making sure that the people really truly feel like they're contributing. So started expanding the sales and marketing, and started looking at, how can we transform the business to have a little bit more reliable revenue instead of just the constant word of mouth. And in med tech startup, um, there's a lot of stop and go through funding cycles, and want to try to figure out how to level that out. And so as I started making some of these changes, Jeff said, "All right, it's time to bump you up to being president." So not that long after coming on board, I became president and started taking over. Uh, Fast forward 2 more years, we've made enough changes. We're ready to sell the company to a large strategic contract manufacturer. So ran the process through that, the entire thing, did the confidential information memorandum, and ran a full proper M&A process. And during that process, I brought on a bunch of sales folks, and as we went out, they'd say, "Oh, you're in Phoenix." Nah, we're not in Phoenix. "Oh, you're a venture capital." No, we're not a venture capital. And so we were like, "All right, we call ourselves PDV, so why not just do a DBA and call ourselves Phoenix DeVentures?" So, or PDV MedTech. So that's what we did. So we launched that name about a year ago. Also, right as we did the acquisition with INDO MIM.
So, given that the investor was a strategic investor, I expect you had some integration into the work you were doing and the work they were doing. How much overlap was there? How much were you unique to what they were already doing there, Brian?
Yeah, we're very unique. They're a metal injection molding firm, so they make components. Basically, if you've driven a car with a turbo, you've flown on a jet airplane,
Mhm.
or you've had robotic surgery, you've had their parts. So they're the largest metal injection molding firm. So if you think about plastic molding, where you get all your consumer plastic pieces that you're doing, tens of millions, your Tide bottle caps and all that stuff, but doing that with metal, a very unique proposition. Um, and one of the things that they found out over the years as they were growing in the med tech space, that people didn't want just the components; they wanted the sub-assemblies and eventually the assemblies, and to help out with development. Because a lot of the
Mhm.
large strategic firms um, don't tend to do early stage ideation very well. Now, that's why there's all the M&A that happens, is because being
Mhm.
outside of the strategics, it's just easier and generally a lot cheaper to go through the iteration. And so they worked on component side. We've primarily been working with startups over the years, trying to help those startups get acquired by these strategics by having the manufacturing, the design, and the quality
Mhm.
regulatory help through our ecosystem. And so we really fill out the early stage side of what INDO wanted to do. And they fill out for us where we started losing customers. We would have customers that would hit production and start ramping up and hitting success in the market. And they'd say, "All right,
Mhm.
well, we now need to look at margin. So we need to lower the price 20 or 30%. And
Right.
unless you can go and drop a couple $1 million in robotics on some of these projects, we couldn't do that." And so having Indomim with having this absolutely crazy level of automation capabilities, they have that. So now we have the ability to take products that require high levels of hand skill labor, and believe it or not, most med tech is hand skill built. It's not your
Interesting.
typical automation. and move it over into being able to take, oh, this step, and this step, we can put it on a robot. And these
Mhm.
still intricate steps under the microscope where you have technicians literally building under the microscope hundreds and hundreds of pieces, that still remains. So to drive down pricing.
Yeah, that's amazing. So, do you see that the development of incremental machine intelligence and robotics capabilities will begin to take more and more of that fine hand and eye work that humans are doing now? Is that something that will happen, or is it a ways down the road?
Yeah, so one of the things that if I think about my career being an astronomer at the University of California, when I got there, the large telescopes all had operators there on site and the astronomers working
Mm-hmm.
on site. Um,
Mm-hmm.
and as travel got more expensive and some of the bigger telescopes came online, we were trying to figure out how can we actually keep these smaller telescopes relevant, or more importantly, how can we make them more available to earlier stage graduate students or undergraduates where they
Right.
don't have the budgets to go and hit them. And so we started putting
Mm-hmm.
automation on there and turning them into semi-automated, semi-robotic telescopes. And then Lick Observatory has two fully robotic telescopes, one of the first for supernova hunting and then extrasolar planet hunting. So taking that technology, and that was those were in the early 2000s to mid 2000s, um, and then I started getting into vision systems in the early 2000s as well, trying to look at defects in microfluidic valves. And that's something that is extremely time consuming under the microscope when you can just have a camera actually go through and do it and in that case, it was actuate a valve, so turn on pneumatic and turn on some lights, get the right focus going, automatic autofocus. So
Mm-hmm.
running through that whole kind of process. INDO MIM does this if you think about making a metal part, you're making 40 million a year, and if you touch it wrong, it breaks, or if you touch it wrong, it gets defective. It has to be fully automated, hands off, completely. All the motion, all the inspection, all has to be 100% robotic. And so as we see that technology, the miniaturization move forward, and the costs will enable it to move upstream so that we can get to where placing a needle, which is one of the hardest things actually to do from robotics, is picking up these tiny little fine needles and putting it in and then gluing it in place.
Mm-hmm.
That when we get to that, which is coming, it's pretty close. Then I think we'll see a lot more higher volume, lower cost because of the automation. As honestly, finding people who can do that skill is really hard. There's not a
Anyway,
lot of
yeah.
people who can look under a microscope, pick up a tiny
Mm-hmm.
little needle, put it in a little hole, and glue it in place.
Yeah, that doesn't sound like it's easy to do at all. But you're saying even machines are actually having to evolve to be able to
Hmm.
do that. Yeah,
Yeah.
interesting. So surprise us with something that's coming in the med tech industry. You're on the cutting edge of things. I mean, I don't want you to tell us anything that's top secret, obviously, but what can we expect in the next few years that's going to change our lives or improve the state of some of the diseases and deterioration we all face as life
Yeah.
goes on?
Personalized medicine. Like that is just absolutely going to happen. AI should definitely help drive that. In certain circumstances, we've been doing personalized medicine for a long time. I was
Yeah.
at Align Technologies, Invisalign. That's personalized medicine. And one
Yeah.
of the things that a lot of people don't realize is through 2015, 2020, in order to get all those retainer aligners made for you
Mhm.
individually, to hit the numbers of people that are getting them, because Invisalign was printing 40,000 unique pieces every single day and
Wow.
all the way through. And so they were using what's called machine learning, which is a very constrained AI, and moving that along. And then, of course, because it's a medical product and we're probably realistically a decade away from being able to not have people in the loop. So the humans would come in and check every single solitary tooth movement all the way through. But that saved tremendous amount of time and enabled that personalized dentistry to actually happen. Same
Mhm.
thing's going to happen with orthopedics. There's if you have a pretty catastrophic crash and your leg gets broken in a bunch of different pieces, typically it requires lots and lots of surgeries, going in and putting different kinds of plates in.
Mhm.
There are technologies out there that are coming, and it's a slow process because you can't screw this up. That
Yeah.
will have little micromotors in there. So as your bones stitch back together, it will move. The mending plates will move to readjust, so that you don't end up with a curved bone or
Oh, okay.
multiple surgeries. Um,
Hmm.
and you just can keep
Wow,
going on and
interesting.
on. Wound care,
Hmm.
no cut is alike, and so everybody sticks Band-Aids on and they come out with scars. But especially with diabetes wounds, having personalized wound care to actually treat the infection that's going on or the tissue damage and things like that. That's going to come. There's lots of companies working on it, and so
Mm.
it'll be really really interesting to see. What hits first, or what hits second, I should say,
Hmm.
since dentistry's
Yeah.
already started there.
So, and you guys at PDV, you're right in the middle of these products that are evolving because
Yeah.
you're doing a lot of the design and prototype to actually execute the early versions of these products. Is that right?
Yep. Yeah. And we're also one of the leaders. We have a partnership with HP on 3D metal printing. And so, we like to print little tchotchke here, things to test out the technology. And so,
Hmm.
plastic printing has come a long way, but not a lot of people
Yeah.
think about metal printing. And
Right.
especially in orthopedics, it's all metal. And so if you want to have a titanium implant or a cobalt chromium or something like that, you have to be able
Hmm.
to do one piece for that one person. And to do that, you're going to 3D metal print it. And so, so we've got that technology. We create the actual powders that go into that. So,
Amazing. Yeah, that's great that capability is evolving. So on the business side, what are the biggest challenges for your company as you kind of look at the next 5 to 10 years?
yeah, so we're startup focused. So our entire mission is to help people, and it doesn't have to be like an early stage startup. It can be a company that's spun out or somebody that really wants to bring up a couple of new product lines. And so if you really want to put it in the tier system, you say a tier three OEM. But
Hmm.
we're designed to take products that are not full end-to-end capability for design manufacturing that a Medtronic might have in-house, for example, and help. But unfortunately, in the last 18 months, the U.S. Funding on research and early stage med tech has evaporated.
Hmm.
So the grants got canceled. So I believe I saw a report saying that it's half the number of NIH grants are going out this year that went out in 2024. And so our
Wow.
biggest challenge is going to be keeping our leadership because of lack of funding.
Mm.
Europe used to think, all right, we need to go to the US because that's the biggest market, still is. We pay more for the same devices than anybody else in the world. Um, and so, but they're starting to turn and go, well, maybe we don't need to go to the US. Maybe we can go here. Europe is doing a pretty good job at funding all the early stage development, which is where all this med tech comes from. No, the large companies fund next generation stuff. It's government agencies that get the early experimentation funded so that then it can spin out into a privately funded startup. Um, so that's kind of the biggest challenges. Um, we had a nice wave going in 23 and 24 of funding coming in, and then it just came to a complete halt. Uh, uh,
Mm.
and it always does right before a presidential election. And
Right.
so when it hit, everybody was like, "Yep, this is the normal." Everything goes on pause. Once the election's over, then it will all come back. And as we know, last year was nothing like a normal year. And then
Right.
tariffs have been extremely challenging for small businesses, for startups, and it's even from our larger customers. The predictability on supply chain has just not been there. We've had deals
Mm.
evaporate in the midst of negotiations because the tariffs just flip-flopped overnight. Things that we
Right.
were working on for months. And so there's a
Yeah.
lot of wait and see going on. There's a tremendous amount of what people like to refer to as dry powder in the PE
Mm.
world and the VC world.
Right.
So there's a lot of money
Absolutely.
on the sidelines waiting to get invested, but the stability just isn't there right now to
Hmm.
deploy that capital.
Yeah, there's too much uncertainty in the business cases, and so
Yeah.
it's just not flying. Yeah, absolutely. Well, that's going to be an interesting challenge. What do you have up your sleeve to tackle that? I'm just curious.
Well, so we are looking a little bit more towards like I said, the tier three size businesses. So we
Hmm.
have this really spectacular prototype to low volume, high mix capabilities, which there's not really, realistically, there's not a lot of companies in med tech that do what we do. If you go to some of the larger ones, the first question they ask is, what's your annual purchase? Is it going to be $3 million, $5 million? And for most of these folks, it's 200,000, $500,000, maybe $800,000. It takes them years
Interesting.
to get to that 3 million. And so they
Yeah.
say, well, come back to us when you hit 3 million. Um,
Yeah.
and the design firms can't do those kind of volumes. It's too high a volume. So we kind of fit this in between. Well, it turns
Hmm.
out that some of the smaller niche product develop or product manufacturers have actually been starting to feel the same thing where, yeah, they've been doing $1 million a year with a large contract manufacturer that's in Taiwan or in Mexico and stuff or Costa Rica. And now they're saying, okay, we're raising your prices 40% because you're not at that $3 million a year. And they're not getting the service that they need. And some of the companies that were being referred to from us, I'm quite surprised, honestly, that they've now moved into that higher tier and aren't even helping the smaller OEMs.
Looks like industry that's ripe for some consolidations during these uncertain
Yeah,
times, I expect.
definitely.
Yeah.
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 Yep.
So, Brian, as you know, in this program, we like to learn lessons from key executives like yourself. So tell us a story, set it up for us. Let us hear something that you thought was an interesting time in your past, and let's see if we can get some leadership lessons coming from that.
Yeah. So I think the one that comes to mind most is actually selling PDV to INDO MIM during this nice kind of continuation, the normal nice rise that one would expect. All of a sudden, we have a faltering economy, and we have no idea if this is going to be a short one or is it long. And it does seem like it's sector by sector because like if you're in AI right now, there's no such thing as a faltering economy. I mean, it's
Right.
exploding, right?
Yeah.
But in med tech, it is, and so it's a very unique time to look at the economics of what's going on. Uh, and so, last year we realistically were one of the very few mergers. There weren't a lot. This year, I
Mm.
think there's already been more mergers and IPOs this year than all of last year. Um, and so selling it last year, um, right as basically the rug was getting pulled out from underneath us was very interesting. Um, so we had a deal structure in place, and obviously I'm not going to go into the terms of the deal structure.
Right. Of
Um,
course.
yeah, and as things never happen as quickly as you want, and as certain delays were happening on reviews during diligence, all of a sudden, we had deals that contracts out that were for sizable amounts getting pushed out and pushed out and pushed out. Um, and so, how do you keep telling the story of the value of what you are? Well, you can only tell a story so long, and when all of a sudden, hey, that revenue that's supposed to drop next quarter, and now you're saying it's dropping next year, you have to make some
Mm.
adjustments for that. And so, the working with INDO MIM, and one of the reasons we picked INDO MIM is we felt like we could work with them as a partner and not just a tuck in where they would really be a true partner and and really get what we do. And the negotiation through that and how we evolved the deal kind of demonstrated it. So
That's interesting. So, how did you recognize that the the partner was going to be someone that you could work with? What were the signals they were sending? Did they have experience in your field, or did they just really deep dive and do due diligence to the extent that you knew they understood your business?
Yeah, so typically in the M&A process, when I've gone through M&As before,
Mhm.
you hire a banker, they hire a banker, they have their due diligence team, you have an audit team, and you set up this kind of adversarial model, and where I don't talk to their CEO directly or anything like that, and we have these like formal meet and greet dinners where it's all very scripted. They do what's called a management presentation, and it's all very, very scripted. And you have all of your data lined out, and it's so that you're presenting only a particular model and that you're directing their questions through. We didn't do it that way. And that was intentional because we've gone through that before. And our business is unique enough where nobody understands this bridge manufacturing, this late stage development to early stage manufacturing, because it doesn't fit in
Mhm.
most people's models. So how do you do that kind of management presentation? It doesn't really work. Um,
Mhm.
and so they didn't hire on their end an M&A banker. They hired an engineer to go out and find somebody. And I didn't hire an M&A banker. I had an M&A banker that I'd worked with in the past who's amazing and who helped kind of guide me on things I didn't know about. But we didn't do the traditional manner. I did run a process as I wanted to make sure we're getting the full deal. And so I worked with the M&A
Mhm.
bankers at the other companies. But it was really they hired an engineer who knew the later stage part of the business. He knew
Yeah.
what he had missed before. And as
Mhm.
especially as we're going through this evolution, um, we had three companies that we kept going through the process until you hit an exclusive step where you can't go any further, right?
Mhm.
And so as we're going through, and as things changed, we're sitting here going, okay, INDO MIM actually gets us. They understand our value proposition. They're not sitting here trying to nickel and dime us down on the deal. They're saying, okay, well, the economy is changing, the business proposition is changing, but we want to preserve the value because we understand the value. And so if things change, we'll set up the structure so that things will come back. And that really showed that they wanted to be a collaborative partner because most companies when they get acquired mess up the integration. So we're a year in and we've done a pretty good job, I think, on the integration because it's
When you
been a
say
collaborative nature.
yeah, when you say you've done a pretty good job, how much have you integrated and how much have you just stayed kind of sequential in your processes and your build?
Yeah, so since we have very little overlap in what we do, that
Mhm.
piece has stayed the same, has stayed as is. The so the parent company is a large organization and headquartered in India and has very restrictive regulatory reporting structures. And so we had to go through all of that. And so we had, the usual, we had to merge over to their banks. Um, and we had to go through, their audit schedule and all of those types of things. And so um, that was the lion's share of what we did. On the sales cycle, we're still working through that. We've been a little more independent than what I'd like on the sales cycle, just because they do stuff that's so different, and so it's taking time to educate their sales team on what we do, what our full capabilities are. It's
Mhm.
realistically, it's a little bit easier for them to teach us how to do theirs than what we do. Because
And
again,
vice
like I said,
versa, yeah. Mhm.
we're even though there's not a lot of metal injection molding firms, most people have never heard of it. It's a pretty straightforward process to understand.
And so as you've been through this kind of merging together of the organizations, what about the people down in the organization, not the leadership teams, but the people who work within the organization? Has there been any friction there? Anything you've encountered that's been difficult to overcome?
Yeah, the time zones honestly have been one of the biggest challenges. So if we're trying to work on a quote together and
Mhm.
we meet with somebody meet with a customer 10 o'clock in the morning.
Hmm.
They're done for the day in India.
Right.
The San Antonio office, they're still there, and so we can work with them. But if we're trying to get something out of the Indian office, um, we'll send off messages and then have to get up early in the morning to see if there's a little bit of back and forth. Um, and so there's been definitely some lost in translation on the emails. So I brought part of the team over to India this over the winter, and it was one of these things. They sit down face to face, and within 20 minutes, they resolved all these questions that they were going, "I don't understand," and we're going, "I don't understand." But
Right.
20 minutes of face to face, it's like, all right, let's look at this product. Let's look at this. Ah, okay, now I get what you meant. And so once that one face to face, okay, when you say this, you mean that. Um,
Mhm.
one quick example is we call these mud insert molds, bridge molds, um, uh, we call it one thing, and we just say it's a bridge mold or a mud insert. They call those
Mhm.
baby molds. Um,
Mm.
and so when we're talking about molds, if we don't put the word baby mold, they think we're thinking large scale, commercial, gigantic volume molds.
Right.
And so like we kept going back and forth on it and on just dumb little things like that. So, but once we got that connection, okay, we got to put baby mold in, then that puts it in a completely different territory. It's a completely different product. So.
What do you do to manage the speed? As I think the improved communication can certainly be a part of that, and it sounds like you've solved some of that. But there's also just the velocity of doing business across time zones and
Mhm.
with another company, even if you're in the same time zone. How have you kept the speed of your operating procedures and your decision making and those kinds of things on pace with where you were before, or maybe even improved it?
So we've actually improved a bunch of these things, and that's where us trying to integrate with them and them trying to integrate with us, oftentimes you'll have a procedure that you won't look at for 6 months or a year or 2 years or
Yeah.
quoting process, and when you're trying to explain it to a new partner that has more inside access than what you do to a customer, you're going, I don't remember how I went from this step to this step to that step. Hmm. Well, and then you dig into it and you're like, oh, well, we can get rid of that now. We don't do that anymore. We don't do that anymore.
Right.
So, yeah, the speed to quoting from when we first started working with them to now went from uh, basically a month to get good quotes to now we're a couple of days. And so that's massively improved. And yeah, and going through these processes, it's, when you have to teach somebody, you learn stuff.
Yeah, exactly. And I guess once you look at the processes again and get your business processes streamlined, the next step would be to say which of these business processes can we automate with AI, with an AI agentic solution. So who's
Mhm.
leading that? Are you leading that, or is the parent leading
Yeah.
that, or are you both kind of
Yeah,
on
that
it?
that that's something I'm leading. Um, yeah, that the AI is something that I'm leading. I've got definitely a little bit more experience on it. Um,
Mhm.
and plus, just me in my role, I'm a change agent. That's what I do. My entire career, I come into organizations, I look at products and processes, and I go, "This hits the market. Let's ramp this up, and let this process is slow. Let's go through and iterate this." And so, AI is just part of that mentality.
Yeah, good for you. Well, I'm glad that you've got the lead on that, and hopefully the parent company will be able to integrate some of this thinking into their
Mhm.
operations as well, which would further streamline. Well, that's a very interesting one. So, where do you see this going? Just to wrap this story up, now you've got what you're a year and a half
We're a
into
year
this now,
in. Yeah, 1 year in.
year in. So you feel like you're ahead of where you probably would have been otherwise because of the great synergy and alignment between the two companies. Where do you think this is going to go 3 years from now, 5 years from now?
Yeah, so 3 to 5 years from now, this it takes medtech sales cycle takes a long time. It's not a
Mhm.
quick thing.
Mhm.
It's pretty common for when you first meet somebody who says they're interested in working with you, it takes 2 years before they actually are ready to go. Um, and so the message of we can help you. We have the ecosystem that covers everything that one needs from napkin sketch to early commercialization. We don't do it all, but we've been working in the industry so long with so many partners that we can cover everything. Where, a doctor or an engineer comes with an idea and they don't have the rest of the team, we can help them build that out. Uh, and having the full scale commercialization, something of the value chain, the supply chain, if you will, that a strategic can look at it and go, right, this is a great product. This is going to change the lives of millions of people. And to do that, we have to make tens of millions risk free, or as risk free as you can get. We've got
Mm,
that. If you ask some of the major strategics about INDO MIM, the phrase I hear back is MIM is magic. And
mm,
we love it. And so we already have a
mm.
super strong reputation on the high volume scale, and we've got a strong reputation on the early scale. So
Yeah,
that
good.
messaging for the market, we think will really help uh, accelerate going from an idea to actually having something that can hit the market. Um,
Right.
yeah,
Yeah, I would expect so. And that connection you have now to the parent will allow you growth opportunities you wouldn't have had otherwise. So that's
yeah,
pretty exciting. Well,
yeah.
good. I appreciate that. I appreciate that. Let me ask you a couple of questions before we wrap up this conversation. So now that you've had all this experience, not only in your corporate career as an engineer and leading companies, but also as just someone who's had some interesting background in the sports and the adventure arena and in astronomy, all that, in mind, what would you tell your younger self if you could rewind 20, 25 years and give yourself one piece of advice? What would that be?
I would say listen more and be patient. So that's what
Yeah.
I would say. Um,
I hear that a lot. Do you feel that when you were a younger man you didn't listen as much and
yeah,
you weren't as
definitely not.
patient?
No, uh, for sure.
Was it
No,
was it that was it that I already know what I want to do and everybody else is just noise, so I'm just going to charge ahead?
yeah, definitely. Yep. Um,
Yeah.
and then feeling like people weren't receiving the message, and I
Mm,
would just often talk over it so much that I wouldn't hear that they did receive the message.
mm,
I had a couple of opportunities to teach at throughout the years, and that really
mhm.
helped because you have to change your messages and you have to hear whether the students actually get it or not. Um,
Yeah. Pretty clear in the test scores whether they got it or not.
yeah, yep.
You got a metric to measure it. All right,
Hmm.
let's fast forward the other direction. You and I are having a cup of coffee, and we're talking about our lives and our careers, looking back on things. What are you going to tell me you're most proud of?
So that we're here in Silicon Valley. It's where the money is for funding startups, and so you have to be here. But what comes along with that is this cutthroat environment, and it's the pace. If you can handle the pace, like I like going fast, and I like getting feedback very very fast, so that it can change and make improvements as fast as possible. Um, and so if you can handle that, it's great, but it's really cutthroat otherwise. And so having a healthy work environment where um, people, like I said at the beginning of the podcast here, that people want to come to work. PDV is all about being able to deliver, literally life-changing, life-saving products um, to end users, one way or another. You hear a lot of, oh, we're going to change the world here in Silicon Valley by adding this little piece of software, and you might. Um, but we have products that literally, if they work, they bring you back from the dead. I mean, your heart is stopped, and you put the device on, and 5 minutes later, you're breathing on your own. So, like literally life-saving devices, life-changing devices. Um, and that feels really good. And if you know, if the people that are here end up liking working here, and like I know I'm not going to be here forever, and if I go somewhere else, and when I go somewhere else, the people that are here want to follow me, then I think I did my job right because I've created the environment where they felt really comfortable to be here.
Yeah, I think you're making a good point because yeah, you're in a unique business, as you pointed out, that you're creating products that literally have a big human impact. But if the people who are there creating these products aren't happy and fulfilled and passionate about it, then you really haven't done your complete job, have you? So
Yeah.
I actually like that response. I think touching other people in a positive way is always the way we need to think about our leadership skills. In my coaching practice, I always focus on, being the highest expression of ourselves means bringing everyone else along as a servant leader, and I believe that's how you get the best productivity. It's how you get the best results across the board. So yeah, good on you. Appreciate that response. So Bryant, thanks very much for the time today. It's been great talking with you. If someone who is listening to this podcast wants to get in touch with PDV or with you, how would they do that?
Yeah, so our website, we've got it, so it's pdvmedtech.com. We have a contact page there, and so that goes to myself and our business development team. If there's somebody who actually has a product they want to talk to us about, we have an NDA right on the website. They can fill it out, and
Hmm.
that way we can have an
Hmm.
open discussion right off the bat. And then you can always find me on LinkedIn and send me a message on LinkedIn as well. Yeah, it's just Bryant Grigsby. Not a lot of people with the name Bryant Grigsby, so it's fairly easy to find.
That's great. Well, it's been great talking with you. We wish you great continued success and look forward to chatting with you and staying in touch. All the
Great.
best.
Thanks. All right.
Thank you. Well, that's it for Driven to Lead today. We really appreciate you being with us. Share this with a friend or a business colleague if you would. And if I could remind you again, please hit the like and subscribe buttons. We're very grateful for that. So until next time, always remember the high road leads to a better place.